Welcome back to the Training Babble Podcast. I'm your host, Dave Schell, and today I'm joined by Martin Kumm. Martin is a sports chiropractor and the chiropractor for Team EF. He's been cycling for a very long time, and today we're going to talk about knee and back pain, as well as any other pains that might show up when you're cycling. Martin, thanks for being here.
Dave, first of all, thank you very much for having me, and I'm really looking forward to that discussion we're going to have today.
So before we jump into it, will you just tell my listeners a little bit more about yourself and your history? How did you get into it? It looks like you were an athlete yourself, and so what inspired you to go down this path?
It's been a journey for me in terms of where I am today. But as you said, I have been an athlete in the past myself. I actually started playing team sports, basketball. I played in a national level, not quite the NBA or EuroLeague level, but in a decent national level when I was young. And then from there, I transferred into triathlon. And as much as I liked the sport, I hated two sports. It was the running and the swimming part. So somehow the life just brought me on to cycling from there. And I moved on to the time trials. And then it was also the time I kind of moved over to UK to study chiropractic in early 2000s. And as you know, time trials are quite big in UK, especially like you just rock up on a weekday or on a weekend and you have these club meetings, and that's what I really started to enjoy and did quite a few years, and also competed there university championships, and then from there I kind of got hooked with the cycling. Graduated 2013 from chiropractic college in Bournemouth in UK. So as you can calculate, I've been doing the thing already for quite a few years, and I've seen a couple of things over the last 13, 14 years. And then when I graduated, my plan and passion was to get involved in cycling. But as you know, sometimes life has its own paths and plans. Also, that was for me like this. So when we moved with my family to Switzerland, that's also where I live now, in Basel, Switzerland. We moved, and I got an opportunity to work in ice hockey.
Oh, okay.
So I started to work with ice hockey, knowing nothing about ice hockey, because the country I'm coming from, Estonia, it's not a very big sport, even though it's growing over the last few years quite a bit. So I worked many, many years in a high-level ice hockey, and then from there went on to working with some of the fastest track and field athletes on athletics part. And then finally, my window opened, and I found my way back to really working in a professional cycling. That's 5 years ago, I think now. I got the call up to join EF team, and that's where I am today. And that's my passion now is really around the cycling, still doing it myself quite frequently, doing some Brent Fondos a year. So I'm trying to apply what I feel on the bike, trying to understand the information from the pros, and then implement that working with my amateur athletes.
Yeah, and I think that's so important. I think it can be really hard as a practitioner if you're not experienced in it yourself. You know, like I think about a lot of times I send an athlete to a PT or something, but if a PT is not an endurance athlete themselves, they might not understand kind of what we're putting our bodies through and what we ask of it. And so I think it's such a good place that you have that to fall back on as well. I think people listening with chiropractic and chiropractors, I think there can be mixed. It's a pretty wide range as far as what people do. But I know in the cycling community that they're pretty reliant on you. Like I live in Boulder, and definitely have sent a lot of my athletes to a chiropractor. And there's some that, maybe aren't as well versed in cycling and things like that. But can you just describe a little bit what it is like if you know the full range there, or the full spectrum as far as what would fall under chiropractic? How does what you do differ from what some other chiropractors do?
I think it's really important that you point that out, and that's a very good actually question, Dave. So thanks for bringing that out. I think it's like with most professions out there, like if we're taking a coach like yourself, for example, like what does a coach do? Like it's such a big umbrella that covers a lot. right? But I think like what I can say from my point of view is that the sports chiropractic that we have in our team, we really look at the human body as a whole functioning system rather than a quick fix and then you go and thank you for coming over and bringing your business here. So that's, I think, also quite a lot in US, the case that you get very fast-paced practice where it's like 5-10 minutes fix, let's hope for the best, basically. So the way I look at the athlete is I try to understand the whole system, starting from, we're going to go deeper into that for sure, but starting from the foot to the knee, the lower back, everything. And then for me, the manual part is one part. It can be very, very important part, but it can also be at times secondary part that, for example, the exercise is much more valuable. So it's a combination between the manual and the exercise. But the key to everything I do is understanding through testing, right? So I have to really understand the whole system first and then see what needs to be done to change or upgrade that system.
Okay. And so this is something that I think it's always top of mind. And I think really around this time of year, I've had athletes that, let's say they've been training on the trainer all winter, and then it starts to get warmer out and they first get out to do their first trail rides. And I hear it a lot of times, knee pain, not as much, but definitely lower back pain. And that's something that we want to tackle. Typically, like my theory has always been that it's just the torque demands of mountain bike, where we try to replicate it on the trainer, but we can't really do it exactly. And so when somebody comes to you and they're complaining of knee or back pain, where does your mind first go?
My mind first goes to a very simple question and I think it's something that is also very important for yourself as a coach, is to understand the word load, right? So before I answer my side of the story, if you hear, what does the word load mean for you as a coach?
Yeah, I mean, this could turn into its own podcast.
Exactly.
But load, I feel like, is all encompassing, and we can be talking about physical load on the body. We can be talking about mental load on the athlete. So psychological load. We can also be talking about chemical load or endocrine load, right? And so it's like, that's what we're trying to do when we're coaching an athlete, is we're trying to apply a load, but just enough that it kind of stresses the system and then back it off so that it can adapt and become more resilient. But if we overload that system, the system breaks down.
Exactly, 100%. And I think as a therapist or a chiropractor, that's where I go maybe a layer a little bit deeper, and I look at the tissues, right? So you as a coach, and please feel free to correct me, is you don't look at the tissue specifically. You don't think if you are loading the quad or if you're loading the lower back muscles or if you're loading, which is totally fine, because you are loading a system so the athlete can get, with an adequate recovery, become stronger, the cardiovascular system and so on, right?
Yeah, I do consider it, but probably not to the extent that you do. But like an example that I'll use is, let's say that I have an athlete that's coming back from a knee injury.
Yeah.
Then I'm taking that into account when we're doing some exercises. I don't want very quick dynamic pace or torque changes. And so it's like because I'm thinking about that and thinking about how tissues adapt at a different rate than a muscle does. And so we need to like take that into consideration. But again, it's like, it's very high level, like, it's just like a gut feeling, I guess. I don't like exactly know how those tissues are.
The fact that you are already thinking about it like this is a next level. So I love that. So, and like for me, the load means like how every single tissue in your human body, like if we take, I think for our conversation point of view, we can stick to a muscle, ligament, tendon, and bone. Probably 4 most important ones in this regards. So I'm looking in any regards how these specific tissues are being loaded. And the equation here is very simple. You have too much load, not enough capacity equals injury. Simple as that. Yeah. Now, every tissue has a different capacity, how much load the tissue can tolerate, and that also is individual and training tolerance and recovery. And we will come back to that later on. But that's the simple formula behind basically any overuse injury. And then the way I separate it in my head is obviously it goes a little bit quicker when I have a patient in front of me, but I'm trying to kind of draw a picture here, like also for your listeners when they go and see a practitioner. Like I think high-level practitioners very similarly think in these paradigms, and they have the similar ideas that you have this acute injury and you have overload injury. Basically, that's two mechanisms of injury. And if we're talking about acute injury, that being a crash, very simple as a crash. I can take it a little deeper if you want and try to explain it, like what does it mean for, like, say, lower back point of view. Like if you have a mountain biker and you have multiple jumps in a parkour, or you have to do some sort of a trickier parts where your body is either leaning a bit more, or you have to be more kind of on the bike to stay on track, and then use the body more to stay on course. And the way I look at it in my head is like you have a x-axis and you have a y-axis. Yeah. And on the x-axis you have a time. And on the y-axis you have a load. Right. And then let's put two peaks on that map, on this chart. You have a small secondary category climb, well, just to give you a magnitude of a peak. And then you have, let's say, horse category climb, just again, much higher. And on the top, you have a vertical line where you have a tissue failure, basically. And in between that first, or the second category climb with the first peak, let's say you have a gap, there's a space between that margin of error on the top, or where the tissue starts to break down, and that secondary climb peak. You have that margin. So let's say you do a couple of jumps, and your body can handle that because you have that safety, that's safe for the tissue to tolerate. Right? You follow me so far?
Yes.
Yeah. And then let's say you have an accident, or you are one-time incident where you have a big jump, you land sideways, the bike goes off, and you have that huge accumulated one-time load where the peak of that load is way higher than any tissue can tolerate. So that calls for injury. Yeah, being that then a muscle tear, being that a ligament tear, a bone fracture, something like this. Simple as that, right? So that would be the mechanics behind acute injury. And then you have a chronic overload injuries. That's leaving out the racing part of the sport. That's where most amateurs who don't race or race less, they are more in that overuse injury category. And there, like I look at it, we have two options. Again, the same graph. You had the x-axis, y-axis, time, load. And on the first graph, I will have, let's say, 6 second category climbs in row. So you have these 6 peaks. Yeah?
Right.
You follow me? Yeah?
Yes.
So that means you have this accumulative trauma over time. It's low load. It doesn't have to be anything big, but it's accumulative. So over time, the vertical line starts to tip. So the margin for error starts to tip. And on the top, that failure point eventually reaches to the point that the peak of the last climb and the injury happens.
And so part of, like, as you're describing this, part of how I think about it, and correct me if I'm wrong, it's as those muscles or tissues, like as their ability to handle load declines, we start to transfer that load to other tissues that aren't as well prepared to handle that load. And that's where we can run into issues. Is that right?
Correct. So that's the direction it's heading to. But then there is the flip side of that. So that would be a repetitive movement. But you can also have a low load, but maintained over a period of time. So example could be a time trial position. Right. So you go up, let's say your second category climb, and then you have a 10 kilometers plateau. That would be an image of that graph. right? So your load goes up and then you plateau, but you stay there. So the stress stays low level, but it's continuously there. It's all the time there. So the tissues are working and working and working until that margin again gets so small that the injury starts to happen. So one of the tissues somewhere in the system starts to break down. It might not be, let's say, the muscle in the lower back. It might be the knee, because that's the weakest link in the system in that case, right? So you have these two mechanisms where you have this multiple small injury or movements that create injury, or you have that sustained stress that creates injury. So you have totally different mechanics, but the same result. And I think for therapy and the recovery and the rehabilitation point of view, you need to understand what type of injury you are rehabilitating.
Right.
Yeah. And now if we bring it even more specifically, let's say to a lower back, there is also this very, I think from my point of view, very important principle to understand. It's called creep. Yeah, I know it sounds a bit weird, but it's not necessarily somebody who's creeping around, but it's a creep principle.
Right.
It's a creep principle where tissue over time under constant load starts to deform. It loses its original capacity. That's basically what it stands for.
Okay.
And the simple of example would be is like when you can take a piece of string, and if you pull it long enough for with even a low level load, at some point it starts to give up a little bit, and it gets a little bit softer, and it gets a little bit softer, and a little bit softer, as long as the load stays the same, until at some point that piece of string will either break or rupture a bit, or it will change its formatting.
Right.
Yeah. And that's very typical now in any case, lower back injuries in cycling, for example. Is that creep principle, because you're staying, maybe less so in the mountain bike because your positions are much more dynamic. But if we're taking the road bike positions, you are in that position that you are fixed. And then the tissues in the lower back, for example, start to change its original structure. The deformity happens. And over a period of time, when, what we said before, when the load is higher than your capacity, the pain appears. Right. And if we're talking about lower back, there is multiple things that can hurt. But the most common ones would be then the disc, the joint itself, the ligaments around the joint, or the bone. Yeah. Or the combination of all of that. And depending on the injury mechanism that like we talked before, this can now be very important to know where this pain is coming from exactly, and bringing it back to your athletes. The torque you work is often one thing, but when we transfer from indoors to outdoors, from me point of view, for me, for example, personally, it's always actually the other way around. When I go from outdoors indoors, I start to having all sorts of injuries. Old things will come back up. Yeah?
Right. Yeah.
Yeah. But obviously, when somebody has done a lot of work indoors and they are really good at indoors and they go outdoors, dynamics changes. So different things, because the capacity requirement because of the load also changes. Right.
Right. And so one thing we haven't talked about yet, but I think where most people's mind goes to, and I think just because you brought up the example of the indoor trainer, a lot of times it goes to bike fit, which I think intuitively it makes sense, because it's like you're in a fixed position, you're doing thousands of repetitions of the movement, you're kind of locked in, where, like you said, outdoors it's much more dynamic, and so you can get away with more, whereas indoors you're kind of stuck in place. And so when people think, oh, it's a bike fit, I need to get a bike fit, how would you respond to that?
I think, like, personal point of view is that bike fit is has a very important aspect of every successful bike riding experience, right? So it's important, but what really matters even the most is the capacity on the bike of that person, right? So how you can manage that load that you are putting through yourself. So bike fit is a very one component of that process. Like, if you are totally off on the bike, then you can have the whole capacity in the world. Like, you can have the best flexibility of the hips, you can have very stable core. At some point, something will start hurting because of that creep principle we just we talked earlier, right? Or vice versa, you can have the best bike fit in the world, but your body is not adapted to that position, or you can't stay or sustain that position, whatever the reason being, you are again back in that creep position or principle where the tissue at some point will start breaking down. So from my point of view, it goes hand in hand. And when we're talking about the bike fit itself, often what happens is that we are trying to fit the bike or the person on the bike.
Right.
That's, I think, it's the worst case. My point of view is like you always have to look at them both, and most likely you need to change the bike towards the person.
Right.
Yeah,
and I think that's a pretty common thing where athletes buy the bike because they see it and they think it looks cool, or it's rated really highly or something like that. And so they buy the bike before consulting someone. And then the fitter is trying to fit the bike to the person as best they can. But a lot of times that means longer stems.
Or the bike was on sale.
Yeah, exactly.
So it has to work. It was on sale. It has to work. I can work around it. And you know, the funny thing here is that when you're young, you're actually going to get most of the times you're going to get away with it.
Right.
Because you can just absorb so much more crap load, to use the word like this.
Yeah.
The moment, like I'm now in this phase, I'm in my early 40s, and I cannot do the same, I don't want to use a word, but like stupid things I used to be able to do 10 years ago. I just don't get away with it anymore.
Yeah, exactly. We talk about this in training all the time where, I mean, I'm late 40s at this point, and I still try to train like I'm 20 sometimes. And you just can't get away with what you used to get away with. And so it's like, it takes longer to recover, and I can't handle as much load, taking it back to what we were talking about before. It's like that load has changed over time, and it's like hard to accept that sometimes. But it's like, if we're trying to have productive load, we really need to respect that.
Yeah. And often what you can do is you can work with your own capacity, basically. So yes, one thing is the training part, but the other thing is doing the prehab things, doing the things that, like when we're talking about the cycling, it's actually quite simple, black and white. It comes down to what you can do through the hips. Yeah. So if you have enough hip extension flexion, so enough hip range, and you can maintain that hip range into your 50s, 60s, 70s, and so on, likelihood that you can ride your bike problem-free for many years is much, much higher compared to people who have become very stiff in their hips, right? So you might see something different, but...
Yeah, will you expand on that? And what does having that hip mobility look like? Like what would be some of the signs that you're lacking hip mobility?
Yeah, so great. So one of the things I always look at first is when my athlete or my rider is standing in front of me, and I ask them to stand back towards me, and I ask them to lift their knee as high as they can, right? Very simple, but this will tell me a couple of things. First of all, I will see what their foot that is on the ground, their knee that is connected to the ground, and the hip on that side. How is that chain acting? Like what I typically see is that foot gets really, really wobbly. That knee either flexes or it loses its stability point of view. So that means the tissues already on the back side of that posterior side of that leg, they are already quite stiff. Plus the sensor motoric through the foot has already altered and changed. Yeah?
Right.
Then we get into that nitty-gritty stuff on that side that you actually bring the knee up, is that you see how high that knee goes. Yeah. And then I ask them what do they feel. So I want that verbal feedback. Some of the times they say, I feel nothing. Some of the times they say, I feel this one, I feel here pulling, I feel a bit of pinch in my hip. And like sometimes we are talking here, the knee comes up to 90 degrees only, let's say. Yeah?
Right.
And we get the hip pinch. So we are automatically, I know that rider cannot sustain a good position on the bike without running out of that capacity very quickly.
What I think about as you're describing this, I think one thing that pops into my head is how good we are at compensating, and how I think about like doing an Ironman and seeing somebody that's running hunched over with their head kind of cocked to the side, and our bodies are very good at figuring out how to work with things and how to overcome. And so it sounds like what you're describing is those compensatory patterns where somehow and you can see it on when you're riding behind somebody too, is like maybe their left knee is kicking out every time at the top of the pedal stroke, but they don't feel it because they've ridden that way for 10 years.
Yeah.
Right.
And the funny thing is that sometimes that knee movement is not the problem at all. Yeah. And sometimes it's a big problem. So now the differentiating factor is like when it's becoming a limitation and when it's not the limitation. Because sometimes, like, again, when we go deeper and we look at the anatomy, so the bones, nothing to do with the movement per se yet, but we just look at the bone and we look at the hip anatomy, is that sometimes physiologically or anatomically, a person is limited on one side. So let's say the hip being a round ball joint, and it has to have basically a 360-degree movement, but it has limitations in certain angles. It cannot, for example, flex, so meaning that it cannot compress itself so much on the front side. That means the brain automatically finds a way a little bit to deviate, and then when you add to that flexion a bit of abduction, meaning the knee goes away from the top tube, let's say, and that works, as long as the other tissues can tolerate that, for that specific rider, that might be totally fine. But then we might have a rider who has that same hip issue, but it has, let's say that rider has already ongoing lower back issue from earlier, or something has happened, or there has been a trauma before, or there is something ongoing. Then this hip problem becomes immediately a problem for that lower back. And even if the hip itself is not giving you any sensation, or the hip feels fine, there is no pain, but there is, like, let's say after an hour, there's always this lower back pain that comes up. And then we look at, the lower back, the muscles are stiff. It must be the muscles. We have to treat the muscles. We do the massage. We do some manipulations. Maybe it feels fine for a couple of hours, maybe a day, maybe a ride, and then it comes back. Right. So then it comes back to the bike fit question. Okay, what do we need to fix now? Is that the person we need to fix, or is it we need to fix the bike position? Right. Probably, like, it's going to be both. You have to work around on both cases, the bike fit and also on the personal side, because oftentimes we can work with these anatomical, or not anatomical, but the physiological limits, meaning the muscles, the ligaments, the structures around, we can work with and we can optimize that. And once you fix that hip, or you improve that hip, or through changing the crank length or the position on the bike, you open up that hip maybe a few millimeters. It doesn't often require a lot more. That lower back starts to calm down, because, again, what we talked about before, you have that creep principle that we kind of reverse then, right?
Yeah.
So you don't have that tissue constant small short lever overload that we reduce, so the tissue heals. Every tissue heals, right? If you give it a chance to heal, it will heal. It's the recovery process of after training. It's the same process for injury healing. It's the same process. Yeah.
And so something, as you're talking about this, something that I really like that you've mentioned a few times is this idea of the chain and the weak link in the chain. And this is, like, I had this experience when I was doing triathlon and I started running more, is like I develop an injury, and it was never, let's say it was my knee that was bothering me, but it typically wasn't the knee that was the issue. It was somewhere lower or further up the chain, because things weren't sliding freely. And so I'd address that. And then the next thing, it would be like somewhere else would start hurting. And it, like, I just had this firsthand experience of, as you fix one weak link, another weak link gets exposed. And so will you just talk a bit more about this idea of the chain and how, like you said, like, it might be the hip, or we see the knee that's kind of jutting out to the side, but it's just compensating for somewhere else in the chain.
Yeah, I love it, and it's a great question, and also very important. And here it doesn't really matter if it's athlete or if somebody's mother. It's basically the same principle. Like, we all have these imbalances. We have the key compensations, and we have, through that, we also have the weak links when things pop up. And, like, when we're talking about a walking mechanism, it's simple as that, is that you have a foot on the ground, and then after a foot is on the ground, kind of everything has to follow from the big toe onwards. So it's all automatic, kind of a domino process once you have everything linked together. Like, what often happens is that when you hit the ground with the foot, the domino pieces are not falling in the right places. So there is a missing link, or the domino piece is too far away. So the one piece is not hitting the other one. So the next muscle cannot work in a way it's originally optimally. I use the word optimal in that sense, is not doing what it's supposed to do. And then somewhere else, something else needs to pick it up. Like, to give you an image, like if you stand on one leg, foot on the ground, and you let your arch drop to the foot, like you can try as hard as you want to keep that knee not collapsing, but most likely, unless you have an anomaly, what's the word now? When you basically, whatever you try, you will not succeed. Your knee is going to collapse inwards.
Okay.
Yeah, that means your glute cannot fire in this position, because it's just the lever arm for that glute muscle is not going to be optimal, so it cannot fire in certain positions. So it just shows you, when you drop the foot, the knee follows, the hip follows, and the hip follows, the lower back follows. Right? We can vice versa, and we say we can pull that arch when you're standing on the foot on the ground. We can pull that arch as high up as we can. And then you can automatically see how your knee starts to travel outwards, how your hip starts to travel outwards. So you bring in the external rotation. So it automatically changes the links in the system, right? Yeah. Does that make any sense so far?
Yeah, absolutely. And so going back to the bikes and bike fit, I think this is another issue I see. And it makes sense. A lot of athletes don't have a lot of time, and so they're doing a lot of their training during the week on a trainer and trying to fit it in as quickly as they can. But if they're training for gravel or they're training for mountain bike, they're not spending time on that bike in that position, and then other issues start to pop up. And so I think, again, you and I talking about load and that our body adapts to the load we impose on it, sounds important that the athletes spend time on the bike they plan on racing, so that they either one, they adapt and their tissues get used to that position and things like that, or they find out earlier that there's an issue so they can address it before the race day.
100%. So like, I think we can take an extreme examples here that, let's say, just to keep it clear, you have a person who loves riding mountain bike, but then that person wants to do a time trial race. Right, just to keep you black and white, right?
Yeah.
So
yeah.
Even I think for like, if you are a novice rider, it just doesn't really make sense. Like you wouldn't do that. But we often think, okay, if we go from road bike to a TT bike, I should be fine, right? But from that load point of view, for those tissues, again, it's totally different load. Like, even in the pros now, when I'm working here, is like, we might have a rider who hasn't been on a TT bike for 6 months, right? It happens. Or it's been a very long period of time, they haven't been on a TT bike. And then they go on a TT bike for that specific race. Even if they don't push hard, they do them, 80, 90%. They are so sore in different places, they didn't even know that they could be sore.
Right.
And the worst case scenario, we have some injuries popping up that we were not expecting. Yeah. So it just shows like how, even on that level, even the tissues being so loaded, used to that load, how much it has an impact. So bringing it back to your question, do I think it's important to train on the bikes you're racing on? 100%. And it's also really important to have that pre-ride routine. So to open up your hips, to activate your core, like those basic things, if you do them over and over, you increase your window that you can actually train and race without getting injury quite significantly.
Okay. And I want to come back to that, but just one more follow-up question on the bike specificity is just to, even besides the injury point of view or avoiding injury, from a performance point of view, like you just said, you have these riders that have not been on a time trial bike in 6 months, but typically, in my experience, like athletes on a time trial bike, they're producing less power. And part of that is that like the position's different, the recruitment pattern's different. And so it's like just from a performance perspective, you want to spend time on that bike because you need to train the muscles that are actually going to be used in that position.
Yeah, 100% agreed with you. I think the highest level, like high level, the difference is probably quite small between like the good TT riders and the good. I think the difference is not very big in terms of if the road bike or a TT bike. They can really produce good numbers on a TT bike. Okay. But obviously it comes down to the time, how much time they spend on the position and how important it is for them.
Yeah.
I remember like from my own times when I was doing TTs quite a bit. When you train a lot and this is your main bike, I think you can really bring them, even as an amateur, you can bring them really close to your like bests.
And that's the point, right? It's like it's spending time in that position. But if you're doing most of your trainings like I'm not a time trial coach anymore for the most part, but it's like if you're spending most of your time sitting straight up on the trainer and producing as much power as you can, and then all of a sudden on the weekend you drop into a TT and you're getting down and your hips closed up and everything, like you shouldn't expect it to produce as much power as you did sitting up because you just haven't trained in that. But like you said, if you spend time in that position and really working on that, you can close that gap, right?
100%. And then when we bring it back to that, say, for example, lower back injuries, like very, very often I see like if somebody hasn't spent a lot of time, even if they go on a road bike on an aero position, but they haven't spent a lot of time on that aero position, meaning on the drops or on the hoods and really on this, I would call it the Ben Healy position where you're really down and you're really going for it.
Yeah.
Then even if in this position, because your body angle is so much forward, that increases for the, let's say, lower back, the discs that are between the two vertebrae. So you have the bony part, then the disc and the bony part in the spine. And that increases that pressure inside that disc so much more compared to when you are on the road bike riding on the tops.
Okay.
This is again, coming back to that tissue loading and creep principle. And you might get away if it's a short, let's say 10, 15, 20 minute TT. But the moment it goes longer than half an hour or an hour or even longer, like say if we take a triathlon TTs, that changes so much. And like, for example, disc itself in spine being pretty much the only tissue in human body that you cannot train to become stronger.
Okay.
Right? Meaning like, if you train your biceps hard enough, it's going to get stronger and going to get bigger. If you do repeated flexions through the spine, bending forward all the time, 100 times, the disc will not get stronger from it. It will actually start delaminating, so it will start actually get weaker. Right? And if it doesn't have enough time to recover, it will kind of keep delaminating, and you bring that small injury, to the next ride, and then to the next ride, and to the next ride, without noticing, or a little niggle here or a little niggle there, but it's not too bad to really think that you should do something about it, right?
Yeah.
So that's like one of the things that we don't think, and it might be that it takes 4 weeks before pain appears, because pain is not always the first sign. The pain is normally the last sign to come up.
Right.
So as a rider, like accumulating load is great, but if it's done in a way that you have enough capacity and over a longer period of time, your body will most likely adapt unless you have anatomical limitation, meaning you just don't have that hip flexion angle to be in this position.
Yeah.
Like if you have that superior position on a road bike and you want to go there, but your anatomical hip hinge is, let's say, 90 degrees, but you require 130 degrees, then you have two options. Either you risk with injury, or you find a position that is lowering that risk.
Yeah.
Right.
So now I want to go back to, you were talking about having a routine before you ride. And again, going back to us talking about getting older and not being able to get away with what we used to get away with. And so, personal experience, it takes longer to warm up. Sometimes you get on the bike and things, it takes a while. I always think about running. Like the first mile of running always felt horrible until things started to fire right and stuff like that. And so you talked about having a routine. do you have a routine that you use with athletes that you would be able to share with us? And is that something I could link to in the show notes or something?
What I would say here is that it's often very specific, in meaning that I wouldn't want to talk about exercises as one exercise or 3 exercises that are good for, let's say, warming up. Because again, exercises were just one tool in that big toolbox. But once the person or the athlete knows what their limitations are, or what needs to be kind of warmed up before they start firing up the engine in a big time, then it becomes like you have these 4, 3, whatever, 2 exercises that help you to get ready. Because the hard part for me here is that for some people or for some riders, it's going to be mobility exercise they need.
Right.
But then you have another rider who needs a stability exercise. And then we can say, okay, let's do a combination. Let me give you 2 exercises for mobility and 2 exercises for stability. But then I'm like, what are we actually trying to achieve then? Because then it becomes soggy and we are not actually hitting any of the nails.
Right.
So that's the specificity part that becomes then tricky. Obviously, I can give you a couple of things that really make sense to open up, because anatomically, let's say, the more you can open up your upper part, so meaning the thoracic spine and your hips, the more likely you are that you're going to be ready to hit the road when the time comes, right? And we can always say, like, look, activating some of the core muscles in different dimensions and different directions is a good idea to be ready again when the efforts are harder and you are already, like, let's say if you're riding crits, I think it should be almost mandatory to really be fired up before you start the racing. So the core is firing, the glutes are firing, and really, like, with some of the explosive exercises to really to do that. So yeah.
So let's just touch on that real quick. You talk about the explosive exercises, you talk about things firing, and I feel like that was something, I don't know, that started hearing a lot more like 10 years ago, that like nobody's glutes were firing, and that seemed to be the answer to everybody's problem, is your glutes aren't firing. And so I guess just generally, how do you make sure that your muscles are firing? Like what are some of those exercises that, and it can be very general, but like, and I think you made the point with crit racing, because there's, again, so much torque, and we're trying to, like, I always think of the analogy of firing a cannon from a rowboat. Like, if you don't have a stable platform, then you're just losing all that power anyway. And so you really need to make sure that you can stabilize the core, so when you are sprinting, it's going into the pedals and not into your hips and your spine and everywhere else. So
100%.
So how do you, what are some of those exercises, or just what do they look like, if you don't want to be too specific about what we're doing?
Sure, and that's a really great point, actually, that you bring it back to that one. One thing I really want to touch also is that as a cyclists, I think we really need to look, like, I know the topic of strength training over the last, let's say, probably 4 or 5 years has really exploded in terms of cycling and performance and rehabilitation, and now all the pro teams have their strength and conditioning coaches, and they have their programs, and then amateurs, I think, are now picking it up, and they're starting doing more and more and more. That's great. No questions about that. The one aspect, I think, what we really need to address here is also being part of that warm-up routine then is eccentric loading, right? So most of the other loads, the type, when we're talking about muscle loading types, most of the other forms you can more or less get through cycling, right? But the eccentric is something that we don't get, and this is beyond cycling. One of the keys, staying healthy and have a healthy lifespan. So whatever you want to do in later after cycling or among or next to cycling. So eccentric loading being some sort of a jumps, some sort of a plyos, some catching, some releasing movements. Like, so if we're talking about, let's say, a couple of really things that I find, like, everybody talks about planks, right? Let's say we have a plank, but the plank you can also do in many different ways. Plank you can do as a a exercise, or you can do a really anti-rotation exercise. Meaning, like if you take it anti-rotation exercise, that means it needs to stop the rotation. So rotation being a movement, for example, when you pull on the bars and you accelerate, you're going to have that huge rotation when you're actually putting through your upper body and the lower body. And often they are separating a little bit. So it's the spine in between that is getting, again, a bit squeezed, and the load goes through there. So that's the meeting point. And often it's the segments between the third and fourth and fifth spine segments where a lot of that torsion is going through, right? So now we can take a approach that let's strengthen that movement, meaning let's do a rotational stability work. And that's where I think a lot of the coaches and S&C coaches, that's where they would do, I don't know, rotational movements, let's say a pull-off press, or they would do Russian twists in terms of twisting something from the side and then letting the body kind of follow and work through the core alongside.
Right.
But if we take the word per se, anti-rotation, it means stopping the movement. And for me, that means you want to stop that rotation. I don't want to see that movement going through the hips, and I don't want to see that movement going through the spine, right? I'm happy to see that movement going through the hips. If we take, again, the Russian twist as an example, and you move upper body straight and you move through the hip to do that movement, and then you explode and you bring it on the other side. So it's the shoulder and the hip are doing the rotational work rather than the spine in between.
Yeah.
And when we bring it back to the front plank, for example, you can keep it really nice and stable working with a balloon basically around, so the whole corset is working. It's not just your front muscle, so you're not trying to kind of engage the hip bones to your chest. You want to stay kind of long, but again, balloon out a bit, kind of have that tension going outwards rather than sucking in. And then you create that barrel around that gives you that stiffness. And then you can start using the torque through the shoulders and through the hips. And then the weak point in between the barrel stays strong and compact.
Yeah.
Right. And there is stages how you can build this up. You can, if you're a novice, so you've never done that before, you can start from being on the knees, starting one knee up, bringing the other knee up, so you're being in a full plank position. Once that gets comfortable and there is no shifting around, you can start tapping your shoulders. You can start rocking back and forth. If that's good, you can start bringing, for example, your one arm on the side. But for a cyclist, I would do that against the wall. So you're not going to be leaning over on one side. So you're going to be stopped and you have a bit of a feedback from the side. Because again, the tendency is that what can happen is that the moment you bring your right hand on your hip, your hips are going to go opposite sides. So you're going to twist again through and then it's not the anti-rotational exercise that already is increasing the rotation. Again, we are facilitating the rotation. Right.
Yeah.
So it's the principle behind it, not the exercise itself.
Yep. That makes sense. So a couple more things before I let you go today. You wrote a blog recently about this idea of a green zone and talking about how you're also taking into account the load on the central nervous system and how that can all play a role in this also. So can you just speak to that a little bit?
Yeah, this is my concept in my head, how I work. So basically how it works is like I have a vertical line in my head, and then you have basically a rainbow on top of it. Yeah. And then inside there you have, on the left-hand side, for example, in this case, you would have not enough load. And then on the right-hand side, you have too much load. Yeah. And then in between, you have the red zone, the yellow zone, and in the middle, you have the green zone. And the idea is the wider your green zone is, meaning the more capacity the tissue has to tolerate the load you want to put through it, the more likely the athlete is to be able to tolerate all the training they want to do. Right. What often happens is when we train more and we have the normal life going on and everything is happening, that green zone, the more we train, is getting smaller and smaller and smaller, meaning either the red zone where the tissue starts to break down or the yellow zone where the lights start to come kind of up, but we are still able to ignore them. These when they enlarge, they get bigger, you start to have issues eventually. So right. My idea and my focus then is when I'm working with athletes is to make sure that with the exercises we can keep that green zone as wide as possible. So the coach for example, like you, then we can load that body with cycling specific exercises or drills or what needs to be done.
And so it sounds like, just to kind of reiterate what you just said, it sounds like it's not just on the bike work or even off the bike work that is considered here. It's also your work life and your family life and all these other things going on in your life that can impact your capacity for load.
100%. And I think that's probably one of the biggest difference between pros and amateur riders like us, who are trying to manage everything and still want to ride and think we are good at it. The pro does their ride. Yes, they have their families, but their main focus is their riding. Everything else is around that, facilitated around that. For amateurs, I think that's where it gets tricky. We still want to do that 3-4 hour ride. We want to put that intensity in there. But then the question is, like, we all have 24 hours, right? So where do we get that? So you have the life coming in there. And that's normally where we're going to take then is either sleep. We're going to sleep a bit less because I think we can push it through if we kind of sleep 6 hours in terms of not 7 or 7.5 or 8 hours. And then we're going to push everything together. Let's say we have to pick up the kids. Like, for example, myself, I have to be in
Right.
19 minutes. I have to pick up my son from training. So everything is planned by the second, but we still want to get everything in. So yes, everything for the amateur point of view kind of goes into that model. And the best ones, I think, also, like when we're talking about the pros, they are able to manage that green zone as large as possible, or at least they are able to listen to that yellow signs coming up early enough so they don't break down to the point that the recovery takes too long. Because from my point of view, performance and injury are the same things.
Yeah, and this is something I've talked about recently, and so it's very timely, where it's this idea that, so ideally at the end of the day, our goal as coaches or practitioners, it's to help the athlete do as much work as they can possibly do. Like that's what performance is who can do the most work. And so we're trying to facilitate consistency by keeping them healthy. And like you just said, it's like if they break down or if they get sick or if they get injured, that's going to disrupt that consistency and going to impact their ability to do work.
100%. And that means injury and performance become basically the same thing.
Yeah, I like that. So before I let you go, you also have a website. I guess, do you have any practical advice for athletes? Like if they're listening to this and they're kind of wondering, like, I wonder if I have any restrictions or if I have any compensations that I'm not noticing. Is there anything they can do at home to highlight some of those issues? And then if they find them, do you have resources, or how would they reach out to you and get help from you?
Sure. So before I go down there, I quickly bring back, because you brought up the green zone, and I think it was really valuable, the concept. But what also the green zone, I didn't mention, is that what it actually includes. And there's 3 components for me. So the one thing is the neurological capacity, like what your neurological system can actually handle. So that being your credit card, for example, like how much your credit card can handle. Yeah. Then you have the neurological readiness, and that being basically your operating system. So operating system, your Windows, your Mac, that's how everything operates together. And then you have the recovery capacity, and that would be your battery.
Okay.
Yeah. So the green zone has to encompass these 3 these parts. And when you manage these 3 parts, so the neurological readiness, tissue load tolerance, and your battery system, then you are in a good go. The moment one of these starts to break down or starts to reduce their capacity, you're going to start having some issues. Either it's going to be your knee, it's going to be your lower back, it's going to be your head, something somewhere is going to pop up. So that would be just like the practical understanding that you can look at it also, the green zone, a little bit this way.
So when you talk about the neurological capacity, like what impacts that? What reduces your capacity? And then 2, what are some of those signs that it might be diminished?
Yeah. So for example, when you do a training session, as a cyclist, we don't often have a lot of neurological inputs in terms of we don't have, depending obviously if you're not doing a track cycling, but if you're doing endurance cycling, your neurological readiness is going to be at quite moderate level. You don't have these huge spikes in terms of like how much is required from your nervous system to muscles fire through the muscles. Like if I take my track and field sprinters, it was always all about how they can go and do that 60-meter sprint they had in front of as a training process, not a race, but as a training, how their nervous system can fire for these 5-6 seconds as light and as fast as possible, right? So as endurance cyclist, it changes a bit. It's not as important how much and how fast it can fire, but our key becomes then how we can keep it firing consistently over a longer period of time. Meaning, like, if your legs feel tired, that doesn't necessarily mean that the neurological system is tired. It can also mean that just the cardiovascular system or the muscle itself is tired. But the nervous system might still be firing quite well. So if you can see the difference there.
Yeah, what I'm thinking about as you're talking about this is I think about times where it's like maybe you did a big race or had a really big training weekend, and then you go to ride the next week, and your cadence might be lower, and it feels like you just can't get your legs to spin faster, and it's like in my mind, it's always that diminished capacity. Like my brain's just not firing as quickly, and so it's like reduced capacity. Do you like? Does that sound like a good way to test it?
That's a very good way of actually looking at it, because like at the end of the day, this comes down again then the neurological tiredness, or it's the muscle fiber itself that cannot contract fast enough.
Okay.
Because it can be that the nervous system is firing well, but just the tissue cannot react because it's broken down enough.
Right.
So most likely in any case, like if you have the tissue is the nervous system is firing full speed, you can try to do sprints, but most likely because the muscle is not firing, it will not work. And can also be vice versa, that yes, the muscle itself is not broken down, but the nervous system is tired. The nervous system can be tired from the work, or you had a very excessive talk with your spouse or with your kid. Like these are also the very for the nervous system, something that really trains the nervous system is to being able to focus. And we don't think about it because the brain does it so much automatically. But like we come home after work and we are just drained sometimes, right?
Right.
And even though we think, oh, we just, I don't know, had 6 hours of this and that, but it was so many focusing things, right? And then we are surprised at why we can't do that specific training. And it's not because maybe that the muscle itself is tired, it's just the nervous system is so trained. So basically it means it cannot feed the muscle fast enough to get that work done, what needs to be done.
Right. And so just to making sure I'm hearing this clearly, it really doesn't matter what the mechanism is, whether it's the muscle that's tired or whether the nervous system isn't firing as quick. It's like either way, the impact is the same. We're at a diminished work capacity in that moment, and we should honor that and kind of listen to it.
I would always say in this case, let's give it a go with a warm-up. So let's say we have a warm-up, and if you feel that the legs are tired, but you are willing to do the warm-up. Let's say we have some activation work there, because sometimes it can be that the nervous system is really tired, but it's not diminished its capacity, it's just kind of tired. But once you get it going, it will start rebooting itself, and you can actually get things done. But when you do your warm-up, and after your warm-up, you still feel like you shouldn't be doing what you are supposed to be doing here on the paper, or the Garmin is telling you, now it starts like 3 times 4-minute efforts, then you stop. That's where you stop. If you do the warm-up, and after warm-up you say, okay, things are coming. Let's do one, let's see how that goes. Let's do the second, let's see. And then comes the important part. You've done the session, and then you have to listen to the body now the next couple of hours and the next morning. If the invoice comes and you feel it really tired and double tired you should be after that training, you went in the reserve. So okay, now you have to pull back the next day because it's going to go in one direction only.
Yeah. And I think this is so, I talk about this a lot, and it's this idea of being flexible and being able to make changes based on how you're feeling. And I think this is something where people that, if you're following a training plan or we feel like we should do it. And that if we don't do the workout that's called for that day, then we've failed or we've fallen short. And it's like, really, it's not. It's like we're, again, like working towards that consistency. And it's like by listening to that, we're improving our ability to do quality work versus just ramming our head against the wall.
Yeah, 100%. But it's so hard once you're in it. It's so hard as an athlete to separate your emotions and your objective timelines, right? So I totally and as also like as a therapist or working with people, I understand so much. Like when they tell me like I've been having this knee pain for 3 or 4 weeks, but I always thought it's gonna get better, right? Because usually at some point it does get better, but this case it didn't get better.
Yeah,
and I totally understand that, and I'm not even like it's okay, fine. Let's see. Okay, now we are at this point. Let's see what we need to do now move you forward and really understand where the missing link is, and then how we can start rebuilding that missing link.
Yeah.
But to bring you back also what you asked me before regarding a routine, like let's like as simple as that. What I also described before is like when you have a test. Let's say you stand upright, you bring your knee up, and you have this as a baseline. You do this every single time before you ride. After 2 months, and you have done this every time, and sometimes you even write down, and also like I've written a booklet about this, and there is 3 tests I often use, and people can download this from my homepage if they want. And there is 3 tests, and you can write notes on every test. And if you do these tests 2 months or 1 month, you will see patterns. And when you see the patterns, you know, okay, when it's time to push, when this tissue can handle this load, and when it's not time to push. And when you push, you're going to probably get injured at some point, right? So this is probably the simplest way. Instead of saying do 60 seconds of plank or do 10 seconds of that, if you understand 2 or 3 of your tests that you do regularly, then you know exactly how you're feeling, and then you know exactly what you need to also do to either to do or not to do.
Fantastic. That's perfect. And so before I let you go, do you have any parting words or parting advice for the listeners? If you could leave them with 1 or 2 pieces of knowledge. I have to say, I've
thoroughly enjoyed this discussion. So I hope people get something out of it. And as I mentioned before, like for me, the message is delivered if we understand one key principle. Injury and performance are the same thing.
Okay.
As simple as that. So if you want to ride better, the longer you can avoid injuries, you're going to perform better. I mean, let's take a World Tour example. Tadej Pogačar has not been injured for the last 2.5 seasons. Now, I'm not saying he's best because of that, but it just helps this 2-3% extra to be consistent. Whereas Vingegaard has been injured, Van der Poel has been injured. Like everybody has had something going on, and this level, and also for the amateur level, it just then starts to add up, right? So the longer you can stay healthy, not getting injured, and the consistency is there, you're going to be able to perform at your goals and what you have set yourself for.
Yeah, I like that. And so, essentially, you're saying that they're opposite sides of the same coin, that performance is, and our goal is to stay consistent. And so it's not the riders who are doing the most, like they're able to do the most work because they're staying healthy. It's not that they're superhuman. They're taking care of their body. They're listening to the signals and not going too far.
Yeah, 100%. Exactly. Yeah. Obviously, as amateur, it is trickier. It's harder. I understand that. But then again, like if you set yourself a goal and you really want to do something, sometimes it's just also deciding, okay, this is the path I want to do. This is the help I need, like having a coach like yourself or having somebody on the injury point of view, like myself. Then you have the team, and then the team can work together and then get you as close to your goals, or give you at least to the best possibility to get there where you want to get.
Yeah, and I just want to touch back on one thing you said. You know, talking about athletes, it's hard when we're in it, and you and I, we're both athletes, and so we know when you're in the moment, it can be hard to be objective. And so really the benefit of having somebody on your team, like you just said, is that they can keep that objective opinion because they're not making emotional choices. They're thinking about what's best for you and the long term versus that workout that day.
Yeah, 100%. I agreed with you. I think that's a very good parting note there, and I think it really nails the whole idea and the conversation.
Fantastic. Well, I've enjoyed this as well. Where can people find you?
Easiest is Instagram, Martin Kumm, my name, and I think you will find me. I have a couple of videos up there, and then also when I'm on the road with Easy EF, I'll try to have a couple of photos from the days when I go along. So it would be interesting for some people to see how the behind the scene works in pro cycling. And I have a homepage, Cycling Talk Clinic, simple as that. And I think these are the two really good ways to get in touch with me.
Fantastic. I'll be sure to add those to the show notes. Thank you very much for your time. I've really appreciated it.
Thank you, Dave. It's been a great conversation. Thank you.
Awesome. Take care.